morning, everyone. I'd like to call this meeting to order. I'd like to first acknowledge that the TNRD connects with many First Nations communities across our vast regional district, and today we are located on the Kamloops to Secwepemc territory, situated within the unceded ancestral lands of the Secwepemc Nation. The TNRD appreciates the partnership that we have with the Kamloops to Secwepemc and respect the territory and land on which they gather today. Any additions to or deletions from the agenda? Director Thorpe. Microphone, please, Director Thorpe. Thank you.
Sorry, it's been a long morning already. I'd like to bring up a request under new business. There is something in your folders, but there is a little bit of an update on that as well. So when we get to that point.
Thank you. And I
thank
believe
you.
that's been fully circulated.
It has, and there is a slight update in the request. Thank you.
Thank you for that. Seeing nothing further, before we move on, just want to acknowledge that online today we have Director Simpson, Director Birch Jones, Director Onslow, Director Demare. Absent is Director Karpuk and Director Sarai, and I believe Councillor Director Newstater will be on her way. She's just a little bit behind. She's doing deputy mayoral duties as we speak. So we have a recommendation for minutes of 4.1. Moved by Director Blackwell, second by Director Hall. All in favor? Contrary minded? Seeing none, that's carried. Thank you. We will go right, sorry, Manager Jeremiah.
Thank you, Chair. As the agenda was amended, could we just have a motion to adopt the agenda as amended, please?
Moved by Director Blackwell, second by Director Thorpe. All in favor of the agenda as amended? Thank you. Perfect. We will go right into delegations, and cancer has been a very big topic for this board for well over a decade, and we've had a lot of good improvements in cancer care and announcements that have been made over the last couple of years, specifically as it relates to radiation and the linear accelerators that are coming. But today we have another pillar of support for cancer care, and it's a grassroots group, and they are here to present what they are providing to the residents of Kamloops. So I'd like to welcome Anne McCarthy, and then Anne, you can introduce the group you're with. Thank you.
Good morning and thank you. My name is Anne McCarthy. I'm the Vice Chair of the Kamloops Cancer Supportive Care Society here in Kamloops. This is our Chair, Leslie Brochu, and our Director, Janice MacDonald. Thank you.
Okay, great. Good morning, all, and thank you for inviting us and listening to us today. I see lots of friendly faces that we've been talking to over the last 4 years, and just want to say thank you very much to the City of Kamloops for your great support over this time. It's a real pleasure to be connecting with your group. We're at that stage of our development that we really need to bring in the broader community. So what I'm going to talk, I'm Leslie Brochu. As Anne mentioned, I'm the president and chair of the Kamloops Cancer Supportive Care Society. And as Anne mentioned, she's the vice chair, and Janice MacDonald, and they'll introduce themselves. We're going to kind of take turns and try to get through this in 10 minutes. I'm just wondering what happens if we run over. Oh, Margot says out. Okay, great.
You have some space.
Okay, I'll just give you a quick outline. So what we're going to cover today, for those of you who aren't aware, who we are and why Kamloops, our partnership with Inspire Health and the Royal Inland Hospital Foundation, our objectives of our society, how we can help cancer patients, how you can help cancer patients, not that you already aren't, and then how to reach us. So the Kamloops Cancer Supportive Care Society is a volunteer nonprofit society that started in 2021. And I have to say, for these few small board members in the last 4 years, we've got a lot of stuff done. So we are 10 board members, community volunteers with either lived cancer experience or as patients or as caregivers. We are passionate about improving Kamloops area. So this is the entire RIH, Interior Health, Kamloops Thompson region that we are working in. Cancer patient outcomes and quality of life through enhanced and better access to cancer supportive care services. So this isn't about treatment. This is about helping people get through treatment and restore their quality of life through and after. So all of the evidence is clear that cancer supportive care services improve the quality of life for patients, improve outcomes, and at the same time, reduce the burden on the healthcare system, get the people out of the emergency services, out of the franticness of the waiting in lines, and get them to the supports to get them through. In 2022, we officially partnered with the Royal Inland Hospital Foundation and Inspire Health, which is a nonprofit society providing cancer supportive care services in British Columbia to help patients access the help they need. So what do we do in this partnership? So the Kamloops Cancer Supportive Care Society, which is our group, advocates. So we're advocates, we've done the research, we do the promotions and marketing to help people get to the services that exist because they don't know or they can't find them. The Royal Inland Hospital Foundation has been an excellent partner. They understand the concept. They're totally committed and have been fundraising to support cancer supportive care services in the entire area. And Inspire Health is a nonprofit supportive care society that have been serving cancer patients in supportive care for 25 years in British Columbia. They have centers in Vancouver, Victoria, and Kelowna. They are funded for Vancouver, Victoria, and Kelowna, and they're soon to be in Kamloops, and we'll talk a little bit more about that. I just on Inspire Health, because they're going to be opening a center here. They're funded, they used to be funded by the Ministry of Health to 70% funding from the ministry and 30% by donation. Over the last 20 years, that's dropped to 50-50. Over the last couple of years, we've been advocating and supporting Inspire Health to get funded for the Kamloops area and have been unsuccessful. Inspire Health is using their existing funding to bring Kamloops into the fold, coupled by local donors. So great organization. So I'm just going to ask Anne McCarthy to give you a quick overview of what supportive care is, just for those that may not have, unfortunately, had this experience.
Thank you, Leslie. As some of you in this room already know, I'm a current cancer patient receiving palliative care through Interior Health and BC Cancer Agency. I was first diagnosed 20 years ago, and through the research and the treatments that I've received, I'm standing here in front of you today, able to speak about cancer supportive care. So as Leslie said, we're not talking about treatment, radiation, chemotherapy, all the drugs and everything that I've received through the healthcare system that thankfully, gratefully, I'm receiving to keep me alive. But what I didn't know 20 years ago and what I've come to learn over these last 2 decades is that there's other things that help you to get through the cancer experience. And you can see up on the screen what some of these things are. So when you're in the depths of it, as I was 20 years ago, you know, bald and bloated from chemo, racing to Kelowna every day, doing the radiation treatment, dealing with all of that, dealing with the drugs, dealing with the stuff that comes along with cancer and treatment. I didn't know what I needed. I didn't know where to find what I didn't know I needed. I didn't know that it was provided in other areas of the province. I didn't know anything. So luckily, I've come in contact with wonderful people within and outside of the healthcare system who've helped me to learn that these are the areas that make the difference in quality of life. So fortunately, because of the high quality of healthcare and cancer treatment in this province, more and more cancer patients are living. When I was first diagnosed, I wasn't expected to live for 5 years. It's been 20 years. A few years ago, I was told I had 6 months to live. That was 8 years ago. So these are the kinds of things that help provide quality of life that make me want to live. There's so many cancer patients that we come across that they don't have the will to make their lives better because they don't know that this exists. So our society, as Leslie said, is part of a 3-way partnership with Royal Inland Hospital Foundation and Inspire Health to help get these supports to cancer patients and caregivers all over our region. And that's what we're here today to talk to you about, is how we can do this. And you'll hear more from us, and hopefully we'll hear more from you. Thank you for listening.
And now I'll ask Janice McDonald just the why Kamloops. I think Anne's made the case, obviously, but I think it's important to know what you no doubt know much of this, but just to really understand what drove us to take this initiative.
Thank you. And isn't Anne wonderful living proof? My hat that I wore for 30 years was looking after cancer patients. And the last 10 years of my career was as a patient care coordinator, where I saw firsthand the gaps in care. And I want you to do a thought experiment. In this room, 50% of you will be affected by cancer. Think of all of your friends, family. 50% of them will be affected by cancer. And the number one thing is people don't know what they don't know, as Anne said. We get wrapped up in chemo, radiation, and surgery, but what about those intangible things of supportive care that can clearly make a difference in your life? On top of that, people are living longer and they don't have access to primary care, such as 30,000 documented unattached patients in our community. And we've been told by the division it's actually as high as 50,000 people in our region. Why do we have such a gap? Well, there's lots of reasons for that, and we're not going to solve that. But what our society wants to do is address these gaps in a way where people don't have to wait 8 months to get counseling. You don't have to, can I, the next slide?
Oh, sorry. So into it, I forgot what I was doing.
You don't have to wait, months or longer or never seeing a dietitian. I would be amazed if you knew you would be amazed to know the statistics of addressing nutrition, exercise, stress in terms of outcome. We give drugs that give a 5% benefit when we know through research that proper nutrition, exercise, dealing with stress, getting sleep actually can improve your quality and quantity of life by a significant and measurable amount. We're not even giving people the option to know these things, but they latch on to the drugs that may extend their life. So basically, I just want to say from my perspective as a nurse, you want to fix everybody and give them the best opportunity possible. And we don't have the resources in our current healthcare system. So our grassroots group has brought something here through virtual services. And luckily, we are going to have more in that horizon with Inspire Health being here.
So just how are we doing for time? Who's the timekeeper?
You can continue on.
Okay, thanks.
You're good. I think we're all really invested in this, and it's welcome news. So please share.
Thank you, thank you. Okay, so and I'll just mention, so Anne is a patient currently, and Janice, I mean, they have huge experience. I come from the role of the caregiver. My son was diagnosed with melanoma 15 years ago, got through the first 5. His chances of survival, it came back, his chances of survival were 5%. Luckily, we arrived on the brink of the introduction of immunotherapy. He was treated in a trial in Edmonton after months and months of searching, desperately searching for care, and has had extraordinary results. And he's getting kicked out of the trial in January, 10 years. So all of the things that Janice and Anne have been talking about, I lived through as the caregiver. My son's a single guy. And I think of all the single people that are unattached to a support group, friends, family, they're financially marginalized. Those folks do not have a chance without supportive care. If they can't get it at home, they do not have a chance. And we wonder why so many people are lost. emotionally marginalized on the streets. You unravel those stories, and where did they come from? They didn't have the support that's necessary. So that's what drives us partly to do this. So we're advocating for, we have been for the last 4 years, a cancer supportive care center in Kamloops. And we were successful with the Rural Inland Hospital Foundation in negotiating a deal with Inspire Health to bring a physical center here. It's opening in January 2026. It'll open at the end of December. It's opening their first phase. It'll be opening in December, taking appointments, and then the grand opening, and you'll all be invited in January. So that was our first objective. So our next objective is to create an information and referral navigation network through people like you out in your communities, all the patient-facing service providers, pharmacists, the Division of Family Practice, chiropractors. You know, this is a grassroots movement. If we all know, we don't have to know exactly what it is. We just need to know where to send a patient for help. That group is just about to launch, and it's called KICN, which is the Kamloops Integrated Community Cancer Navigation Network. And in the outlying areas, we've been working hard with the Indigenous communities, and now we're targeting as well the small communities. We need advocates in those communities to get people to the help that they need, because the communications for patients are just not there. So we need to get people to help. Our next objective that we are working on is developing a peer support network, because we don't have that really either. There's 3 support groups in Kamloops, but that's it, and thousands of patients. So we're working, that's another initiative. And then ongoing research to continue to identify gaps and how can we help fill those services. So what have we accomplished? Well, together with Heidi, we developed the partnership with Inspire Health, and right now they're providing online services and in-person teleconference, but we're going to have an in-person center. It's on its way. We've connected hundreds of cancer patients with Inspire Health for help over the last 2 years for access to physician counseling, dietitian, exercise therapy. And we've developed relevant legal and financial resource page where financial and legal are huge. You know, what do I do legally? My situation, I came up across a lot of hurdles looking after my son. You know, the system said, no, I can't tell you, he's an adult. You can't do that. Yes, you can. I happen to have a representation agreement. I can speak for him. People don't know that. That's a simple thing. They simply don't know. And what happens? They fall through the crack. People need help. Legally, back to work. So sorry, financially, all the financial services that are available, people actually don't know how to accept them. And work, back to work, the stigma of a cancer patient going back to work is very big. So these are just the day-to-day things that people are experiencing, that if you haven't been down that road, you have no idea. So again, our community navigation network is underway. Our peer support group network, that project is underway. I think I mentioned what this is. It's a local initiative to connect patients to services, and this is in the entire area. And it's a dynamic network, not onerous. It's just simply, right now we are working with the Division of Family Practice as our test. Every 3 months we meet, we exchange information. What our group knows about supportive care, we pass that on. They pass it on to their members who are doctors, and they feed information back to us. So it keeps everybody informed of how to get help. There will be an annual community forum, and there will be a single point web-based resource for this network. So how can we help? Okay, what's happened to my slide? Oh, there, that's how, oh, tricky. Somebody put a nice little feature in there. So how can we help? We can be a resource for patients and caregivers. We can help you in your community, help you advocate in your community to connect patients with help. So in these small communities, we need that person on the ground that knows everything that's going on in town. I can probably find someone in Chase because that's close to me. Where's oh, there's Dan. So it's just simply, I heard somebody they tell you about their cancer experience, and it's like, okay, well here, this is the number you call. Just that simple. We're not asking for much, and we can be a referral source for you. How can you help? You can share information about cancer supportive care services wherever you are. The pharmacist, ideal. I walked in the other day to get my COVID shot. The pharmacist was dealing with a cancer patient. And of course, I could overhear. I didn't step in, spoke to him after. And he said, oh, I wish I had known about you 15 minutes ago. I said, it's okay. Here it is. You've got her name. Here's the information. And so we're signing up all the pharmacists as well because they're absolutely frontline. Join our network, stay informed about what's going on. When you hear of something, there will be a central place you can tell us about gaps that you're experiencing in your community. Either if there isn't something that's available, we'll look at how can we help with that. Financially support Inspire Health and the Royal Inland Hospital Foundation in your communities, which I know you already are. And I guess what I'd like to ask you is, I know you're overloaded. Everybody is so busy. How do you think that you could help? Mike Grenier, let me ask you. Nice to see you.
Microphone, please, Director Grenier. Thank you.
Thank you, Chair. It's a wonderful presentation. Great to hear about this service, and I know it's a success because you're front and center telling us about it, and everything you do is a success. So thank you.
Well, there's a couple of things that don't really. I was asking what you can do.
I don't know. What can I do?
What can you do? Well, you're connected to all of your community. You can just sign on when we come and ask you and say, yes, I'll find you someone in my area that will be the advocate, that will know about this, so that when you start talking about it in your area, that you can say, just call so-and-so and they're going to connect you with the right people. It doesn't need to be onerous. It just needs to, we all just need to be informed. Okay, Margot, what can you do?
Thank you. So
I like the fact that I know people in this room.
yeah, so we could just 1 second, is your presentation finished
Yes,
before we
please.
start going? Okay, so we'll finish up your presentations because I think there's going to be a lot of
Okay.
questions from directors to your group, so please carry on.
Okay, all right. So my finish is just this. Oh. Thank you. Thank you for your time. This is how you reach us. This is how patients get help, Inspire Health. They would be connected with a care coordinator that would do an assessment of their needs and direct them to the Inspire Health Center, Phase 1 in Kamloops. We'll have a supportive cancer care physician, an exercise therapist, a dietitian, and a clinical counselor. And people will be able to see them in person or make appointments online. My information is here, as is Anne. We're the president and vice president of the Cancer Supportive Care Society. Heidi, of course, is our partner. She knows all about it. And we'll be out, now that we've had this opportunity to present to you, we'll be out to talk to each of you and make sure that you have an easy way to get access to these resources. Thanks again.
Thank you. Anne, Leslie, and Janice, I think on behalf of the board, thank you not just for coming here today to share your stories and what you're doing, but everything you have done and got us to this point. I think everything that we've heard, it's community. You're addressing community needs, and that's through Inspire Health, the Kamloops Cancer Supportive Care Society, and the foundation. That's community, and you're stepping up to the bar to meet community needs. And as incumbent as it is us as elected officials to lobby the provincial government to push on interior health to say this is what we need. Your group is doing this, and frankly, I think you're doing it better than government could do if they were to just throw money at things.
Yeah, but
Because it's the passion and the heart. So thank you. And I'm first on the speakers list, Director Middleton, so give me just 1 second. I just have one question. We have a very wide geographical area that the TRHD covers. And I'm just wondering, in your presentation, it says Kamloops area in quotations. Can people from all over the region or the TRHD access through Inspire Health, or are there boundaries? How does that work? Thank you.
yes, all through the region. And that's why we want to create this community navigation network, is to get out and talk to, right out to Clearwater, right up to Williams Lake, down into the Nicola and out to the Shuswap. It's the entire area, and I'm sure those people have even more difficulty accessing services than Central Kamloops. Also, with the First Nations, we have been working with Letemelman Health Society, or the former Shuswap Health Caucus, for 2 years, and we present to them every quarter with an update. So we want to be able to keep this group as updated. And it's really just getting people from where they're at to these resources. Does that answer your question?
Thank you. Yes, that's wonderful. Do have a speakers list here. We have Director Middleton, Birch Jones, Onslow Hall. Director Middleton.
Thank you and welcome. Great presentation. I've seen it before and it's always,
Didn't
it's
sleep over it.
emotional. It's something that's so important. So I'm just going to go back to your one, which was the, the financial support. Are you a registered charity? Can people make donations online directly to you, or do those need to go through the foundation for tax purposes, shall we say, to make its way back to your organization?
Yeah, no, we're not a charitable organization. We can take donations if people don't want a receipt. But at the same time, the foundation's been very, very generous and has helped fund us. Our budget's pretty darn small. But the foundation is the charitable organization, our partner. They take the donations, they separate to a category for cancer supportive care. And that's how the initiatives are funded. So I just want to mention, just on the funding stream, so when the Ministry of Health did not increase Inspire Health's budget to account for Kamloops, Heidi and the CEO of Inspire Health and myself and our group, we got together, well, how do we make this work? And looking at all different options. And the foundation, of course, stepped up right away. Well, we can do part. Inspire Health said, well, we'll take part of our existing budget that's allocated for other areas of the province. We'll take part. And there was a big gap. There is a big gap. And so thank you very much to Anthony Salaturo and the Pink Ribbon Gala group. Anthony stepped up with $1 million to bridge the gap for 3 years. Anthony, if you don't know him, he's a local entrepreneur and philanthropist. And of course, his family had cancer experience as well. And he was hanging on to that money for a while, looking for the right opportunity. And bringing Inspire Health to Kamloops is the right opportunity, and he saw it, and he did that. So the Inspire Health Center is opening on a smaller scale in Kamloops because of the limited budget. Anthony is backstopping that with the foundation for 3 years, because typically it's not the type of thing that the foundation would fund, right, Heidi? Oh, she would. Okay, so she's in. Okay, good, for a long time. That's great. But there still is this gap that we'll be starting, as soon as we get open, we'll be starting. What happens in year 4? So ideally, we would like our own building somewhere. And so that might be something to think about long-term for your group. Anyway, that's a long answer to that question, Margot, but that's the financial situation.
Supplemental.
Just supplemental then, and then perhaps this can even go back through to Heidi. So if a individual chooses to make a donation through the foundation, and you're saying to cancer supportive care as your selection of what you're choosing to support, would 100% of your donation go back through to Inspire, or would that donation just be received and then dispersed as to where the foundation chooses to put those dollars?
I see we have the CEO of Royal
Sorry.
Mainland Hospital Foundation, Heidi Coleman.
So we have a few funds in the foundations. We have one for Inspire Health, and we have one for the Kamloops Supportive Care Network. So some people donate directly to Inspire Health through us, or they go right to Inspire Health. But we hold a fund for this group. We've been paying for their website, and all the, whatever they need, they've been coming to us and we have a fund. And if the fund goes too low, then we'll help them with general cancer donations that are unrestricted. So that's how it's working right now. And so yes, 100% is going to their needs. Leslie will bill me for certain things that she needs. And that's how we're doing this in a grassroots way, following CRA to the T.
Thank you very much.
Thank you. Director Birch Jones online.
Thank you. And Chair O'Reilly, you asked my main question about the extent, how far the service reaches. I'm Area B, which surrounds Lillooet. I would be happy to connect you with some good contacts in Lillooet, both First Nations and in the health field. What would be helpful is if you prepared just a little blurb about your organization with your contact information, like you just put up, and sent it maybe through this board out to the directors, and then we could share that on. That would be terrific. Thank you for your work, and it was a good presentation too.
Thank you. And yes, we are just about to, we've finished up the information they're referring to in specific about the network, and we will be sharing that with each of you, and I welcome getting in touch with you. Thank you.
And Director Birch Jones, hot off the press at 10:31, you've received this full presentation in your inbox. So all the contact information is in there. We'll go to Director Onslow
job.
online. Director Onslow?
Thank you very much. Thanks for the presentation. Basically, Director Birch Jones has said exactly what I was going to be asking for. I as well am in Area B, but within the TNRD. So my area is Blue River and the communities of Avola, and happy to share information. And I am also a mother of a cancer child, and we have been dealing with his illness for the last 6 years. And one of the major gaps in Blue River was that our communities never fell under any of the charitable organizations that could help financially. And so there was other sorts of support, et cetera. So I'm just really happy to hear that there's another group that we, as parents of sick children, can actually access that's closer to home and not in Vancouver. So thank you so much. I look forward to working with you guys.
Great. Thanks very much.
Thank you. Director Hall.
Thank you, Chair. Great presentation, ladies. So nice to see you here again. Well, we saw you at City Hall doing a similar presentation. So it's good to see that you're on the road. And by the sounds of it, it sounds like you need to get your message out to communities surrounding Kamloops as well. And I took in all the information, and I think, Leslie, you had said that you used to have like 70% of your funding, supported. Now it's coming through Inspire, through Royal Inland Hospital Foundation and Heidi's group, and a shout out to Heidi and her group, because they do a wonderful job for all of us here in Kamloops. And it's so nice to see that, for you. But you asked, Director Grenier, what could he do? And I'm sitting here
Picking on him, Kelly.
I know. I was thinking, like, you should have maybe asked me, because I'll tell you what you can do.
Good one.
Okay. I think you need to get into senior centers and
Yes.
to the YMCA, and share your story, because cancer survivors, and I'm one, are reluctant to share unless they have a network. And there's a tremendous amount of people in community that don't have that network and don't have that ability to share. So if you're into some of the communities where you have senior centers, where you have the YMCA, where you have community recreational centers, I think you would find success there, but I also think you could advocate for donations as well. So anyways, I just wanted to say thanks for coming in.
you.
Message.
And that's absolutely what we need to do. I mean, there's only 10 of us, and we're a small group, but having the Inspire Health Center opening now and not just patients accessing virtual services, this is the real deal, somewhere where people can actually go physically, look people in the eye and get some help, has really been a huge jump for the whole community in the group, because now we can actually go out. Something is really, really tangible. They're going to be here in our area. So looking forward to actually making all those connections. Thanks. We'll take you on the road with us.
Thank you. And we have Director Demare online to close.
Thank you for the presentation. I'm currently going through scenarios with a family member that has cancer, and I'm just wondering if you could do a webinar, or with that presentation, do a webinar that could be, we could share the link to the webinar so that people throughout the whole region could actually partake in it. Another thing that could be done is do a clip of this portion of the meeting. But we need to get that message out and just send it out the website or just that presentation doesn't serve it justice, because you speaking to it, your team speaking to it has a greater impact. So just a couple of suggestions.
You can consider that done. We'll do that. That's a great idea. And we'll definitely do that. Thank you for that.
Yeah, thank you.
Thank you, Director Demare. Again, thank you for coming in, and please get us the invitation to the grand opening, and we will distribute it to the entire board. And I can suggest you'll probably have a very big turnout from our group.
Thank you very much. And I do want to thank the members of City Council that did come to the announcement of the center. It's at Kamloops Square. Renos are underway. So thank you, Dale and Margot and Kelly and Mike. I can't remember who else was there, but it was really great to have the City of Kamloops support. Thank you.
Thank you. I think that's one of the first applauses we've had from the board, so take that for what you will. Thank you. Moving to 6.1, virtual care update, and we have Royal Island Hospital Executive Director Karen Cooper, and we have a contingent from Interior Health with us, and Karen, I'll let you introduce as you need. Thank you.
Yeah, thank you. That is a very inspiring act to follow and a very fierce group of women. So thank you for having me. I'll just do a slight title correction, Chair O'Reilly. I'm the Executive Director for the Thompson Caribou Rural Portfolio with Interior Health. And I'm hoping the slide deck could be brought up, please. While we're waiting for the slide deck, I'll just do a little bit of background. So what we're bringing forward this morning is a proposal that we're envisioning for our rural emergency departments as a way to enhance access. I think that everyone in this room knows that it has been a challenge, and we have had a number of emergency department diversions in our rural sites. And so we need to envision a different way forward in order to not only stabilize services, but sustain them for a long run. So I'll walk you through what we're proposing, and at the end, leave ample time for feedback and questions. I'll acknowledge that I'm gratefully on the ancestral unceded territories of the Secwepemc people, on whose lands we're here to collaborate today. So there are emerging solutions for solving rural emergency department diversions. Certainly incentivizing folks, both staff and providers, to come into rural communities has paid off. We've also been able to be very successful to recruit physicians into these rural communities through the Practice Ready assessment program. These are physicians that are fully licensed and trained in a foreign country. So they come in, and for a return of service of 3 years, they really do help to stabilize our provider groups. As well, we have the IMG program through UBC, and these are Canadian graduates who attended medical school abroad, and now they come home and for a return of service of 2 years, help to support our rural emergency departments. And as you can see in the picture, our Vice President Diane Shendrick, who is here today, that is the virtual support for inpatient care at Caribou Memorial that we're exactly a year into and seeing quite high success with being able to keep patients closer to home. Many of you have heard of a program called Rudy or Vera, and that is a virtual emergency room support through the Rural Coordination Center of BC. And we've been using that successfully, mostly in the cusp, but also shifts in Clearwater and in Lillooet. So we did extensive homework before we came forward with this new proposed model, and we looked at how virtual support of emergency departments looked across the nation. And we stole some of the best elements from across the nation, and we also looked to address some of the gaps that were identified by our partners. So you can see in our neighboring provinces of Alberta and Saskatchewan, both of those models are quite similar in that they have providers that cover multiple sites in a virtual way. What you'll note is different as I walk through our model is not one model across the country also has the security of an in-person physician resting in the community should the needs that come through the doors require us to have a second physician be hands-on. So why did we pick the 4 sites of Lillooet, Clearwater, Nakusp, and Princeton? They fit the profile that we saw across the nation of where virtual care as an augmentation of in-person care is still producing high quality and safe care. You can see that we looked at the overnight volumes of these 4 sites, and you can see their average overnight visits. So when combined, total about 9.4. When you further break down those overnight visits, you can see that the majority are what we call CTAS, the triage scores of urgent, level 3, 4, and 5. And about 13–14% are in that CTAS 1 and 2. So those 1 and 2s may be a case for where we would wake up the in-person physician in the community, but the majority of cases that do come in overnight in these sites could be easily managed by a virtual provider. So this is what it looks like. So let's choose, Mayor Blackwell, your community. Let's say that Clearwater has the in-person physician. The other 3 sites in that same overnight period, 8 p.m. to 8 a.m., would be able to access that Clearwater physician for virtual support. So Lillooet, Nakusp, and Princeton would have nurses on the ground, and that virtual provider from Clearwater would be through a specialized clinical iPad to be able to support that patient visit. As I said, though, in each of those 3 other communities, there is a physician that's on call. So if we know, let's say ambulance radios ahead and says, we have a car accident, we're bringing in some very sick folks, we would go ahead and wake up that backup provider to come in and provide the in-person care. So the ability then to be able to meet the needs of the community from a buffering and keeping the emergency open and balancing that with what we've heard from our return of service physicians, that one of the challenges they have in staying in the rural communities after their 3 years of service was the burden of overnight care and the difficulty in having work-life balance when every 3rd or 4th night you're staying up all night. So when we've engaged our physicians in each of the 4 sites, that's one of the big reasons that they're champions of this is just knowing that you're going to more of a 1 in 24, staying up all night and being available though to your community should the need arise that you do need to come in. So with that, I just would love to know what questions you have about the model or any concerns you'd like to raise today.
Thank you for that presentation. We'll start with Director Birch Jones online.
Thank you. I'm in the Lillooet area, and of course, you know the extent of closures that we've suffered the last few years, and I really appreciate IH trying this system. I appreciate some of the advantages of it and kind of the economy of scales that you're using here. It makes sense. In Lillooet, all we have is PRA docs. So when you say they're fully licensed and trained, those are foreign trained docs. They don't necessarily have emergency training as part of their training, as you well know. And so adding an extra layer with them providing remote care, which is more challenging, to communities working with staff that they don't know as well. They'll get to know them over time for sure. Adds kind of extra risk. And I'm wondering, like when we use Rudy or we use Vera, what we have there is experienced emergency room docs providing the service. It works really well. PRAs aren't necessarily experienced emergency room doctors, as you know. So what I'm concerned about is now that IH is taking this on as an internal program, I'd like to know how you're doing the quality assurance for this service, particularly the medical remote service. Will that be, well, I'll let you just answer that question, and thank you for your presentation.
And thank you for your question, Director Birch-Jones. It's very astute. So the practice ready assessment physicians do go through that assessment period and have preceptorship support to ensure that they're safe to provide care in the emergency. And some of our sites are presently going through that, as you've noted, the 3 new physicians in Lillooet. So how we're launching or proposing to launch this is with a soft launch, in that we know we have readiness in at least half of our physician pool, and we want to treat this as a learning project to bring others along to get to that level of competency that they are confident in providing that virtual service. So you're absolutely right. We need to sequence it with them first being comfortable providing in-person care in these emergencies, and then being supported through robust training and mentorship to be able to provide virtual overnight care. So that is what we have put in place in order to bring everyone along. And while you'll hear the term soft launch, we want to bring along those that have readiness. We have a number of physicians that have worked in other jurisdictions in this model. They've put up their hand, they'll go first. And so we'll, over time, bring everyone along. As to how we're going to ensure that this is safe for the long run is by doing robust evaluation along the way, looking at the number of times we've had to wake up that in-person provider, looking at the number of times we've had to transfer somebody out. All sorts of metrics that will help us determine the safety and efficacy of this project.
Thank you for that. The speakers list is Director Getz, Roden, O'Reilly, Blackwell. Director Getz.
Thank you, Karen. Just a couple quick questions. We talk about this in a minute, but we talked about new doctors being brought in. When new doctors come in, why do they seem to run into a roadblock with physicians and hospitals that are kind of denying them access to hospital privileges? Why do we still run into that?
Can you be more specific, Mayor Getz, around the roadblock around privileging?
Sometimes you're just not allowed to have privileges up at the hospital by senior doctors. We've run into this in Merritt, and I'm just wondering why this happens. Maybe I'll leave that with you.
Please leave that with me. I haven't seen that
I've had issues with it.
in a recent time, but if it's a concern, I can certainly
Sure.
have our medical affairs team address it.
The virtual doctor situation, is there a limit of a community? Like, let's say you have, like our community with Shawakam Health, we have now 9 doctors. I'm assuming we would never be in the running for this with 9 doctors in the community, or is there a number? Do you look at a number like, do you go by population with doctors in, let's say somebody like Lillooet has 1 doctor. I'm assuming this would be something that would be used, but something like Merritt where we have 9, I don't imagine we'd be on the spectrum for this.
So how we chose these 4 communities as a place to really evaluate this as a viable solution was by their remoteness, by their previous amount of diversions that they've had. But it really did come down to all the evidence across the nation shows that 1 to 2 visits an hour when you're being covered by a virtual model is the ideal. And so while we could envision models that would increase our capacity for higher volume sites such as Nicola Valley Hospital, let's study it first in a low volume site and really make sure that that this is a solution that we would scale and spread if it's proven. So visit volumes was the biggest determining factor, and your overnight volumes in Merritt are higher than that 1 to 2 per hour cadence that we're looking for within this project.
Okay, one last quick one.
Supplemental.
Nurses, I know you can't do virtual nurses. Is there some other project that you're going to be bringing to us to help us with that? Because that seems to be where our stumbling block is.
You're absolutely right. This is a proposal that addresses half of the equation, and you so rightly articulated that the other half is the on-site hands, and that is the nursing staff. And so, as you know, we have had challenges in recruitment of nurses to rural. We talked about the incentives on the one slide, but we're still buffering those sites heavily with agency and travel nursing, and we'll continue to do so. Those 4 sites in the pilot do have some priority access to that external workforce pool as we study this. And, you know, I think there's a number of things that give me hope on the nursing recruitment front. We're starting to see our seats be filled in nursing schools. We ran into a couple of years after the pandemic where we didn't fill all of our seats, and we're filling them again. And the other is, of course, the immense interest from south of the border in coming north.
Just one real quick thing, Chair. I've been a bit of a critic with IHA, not IHA, but the health system. And I just want to let people know, we've enjoyed about 8.5 months of no closures. And I put that totally on your shoulders and the work you've done with us. So one of the things that when the lady asked about the cancer center, what can you do? Work with your director. Call your director when you're not sure of something or when something's going wrong. So I know you and your staff have worked hard and we appreciate it. So thank you very much.
Thank you, Mayor Getz. I did note that the ladies left before I could promise them that our home health teams will be provided that information as they support many, many cancer folks.
Thank you. And Director Getz, thank you for taking that moment to applaud because often we don't get to do that around this table, and it is important to give credit where credit is due. So thank you. Director Roden.
Thank you. Any chance after this has been piloted that we might get emergency services back in Ashcroft using a model like this? Ashcroft, of course, serves residents of areas E, I, and J, Ashcroft, Cache Creek, Clinton, catchment area of several thousand people. The UPCC has been wonderful. I just heard what Chair O'Reilly said, so thank you for the UPCC, but that still leaves us 8 p.m. to 8 a.m. every day of the week with no emergency services, no coverage whatsoever. It would be wonderful to think that this could be brought back to Ashcroft to give us something like the coverage that we had for decades when we had a full service hospital that was open 24/7.
Thank you for your advocacy, Mayor Roden, and I'll take it under advisement.
Thank you. My question just being around working with WCB and heavy industry as an example. We have large resource projects and companies that are looking to start or companies that are already going, and how that overlaps with their occupational health and safety plan for their operations, because this is a fundamental change of saying, okay, this is virtual, and how does that overlap, and have those conversations happen, not just with industry, but with WCB, and if that cover is acceptable?
Thank you for flagging that. Having worked through this with Highland Valley, we know that their requirements are that they have access to emergency care. So I really want to stress that there isn't a label on the emergency of in-person or virtual. It's open versus closed. And when we have virtual support, that emergency department is open, and I think ticks the box that we need for major industry.
Wonderful. Thank you. That answered my question. Director Blackwell.
Yeah, thank you for the presentation again. I just would like you, if you could, to just expand a little bit on the nurses portion of this pilot project. It's considering Adrian Gear loads me up with her ratios matter paraphernalia every time I see her. So can you just explain to the group how the nursing part of this works?
Yeah, thank you for your question, Mayor. So presently, 2 of the 4 pilot sites are running on an overnight nursing model of a lone nurse in the ED. That is changing under what Mayor Blackwell is referencing, the minimum nurse-patient ratios. So both Lillooet and Clearwater will have now 2 nurses on overnight. One of the reasons I think that we have barriers for recruitment is being that lone emergency nurse is very daunting. And so I'm confident that this new coverage model will lead to more recruitment and retention in our rural sites. You now have a buddy And that makes all the difference overnight. And so we will, for the launch of the soft launch, have a 2-nurse model in all 4 sites.
Wonderful, thank you. Director Sal?
Thank you, Chair. And related to Blackwell, Director Black or Vice Chair Blackwell's comments, part of my residents are also working in the Clearwater Hospital there and gave me some feedback. And just for the record, whenever they give me feedback, I always direct them to please work with your management. But I do want to share, yes, like in terms of the nursing, ER nurses, have they been, consulted so that they don't feel that there's any downloading of responsibilities to them so that, we don't end up, on one hand, increasing work-life balance for doctors, but then other parts stop feeling. Thank you.
No, what an excellent question. We certainly don't want to do it at the expense of our nurses. And so we did meet with the Folsom nursing team in Clearwater on Monday, overwhelmingly positive. And, you flagged what one of their key concerns were, but moving from a single nurse to a 2-nurse model and having really one that could be dedicated with the virtual physician while the other manages all the other care in the emergency. Certainly relieved them of any worries about additional workload burden. So I think, for the most part, our nurses are quite excited because it's very morally distressing for them when we go on diversion and when they're not available to their home communities.
Thank you. Supplemental?
Yes, yeah, or second question. Thank you for that. And on the IT infrastructure front, so I'm not a IT expert, but I would assume there would be increase in need for some sort of technology upgrade. Is that coming hand in hand with this program? Thank you.
It is, and it's a bit of a sneak peek of Dan's presentation to follow. What we learned at Caribou Memorial, because it's a paper-based site, is that support from a virtual provider comes with additional, phone, fax, orders are done on paper. It's very clunky and very slow. So I'm very grateful to Interior Health for supporting with these 4 pilot sites, their move to go fully electronic as a medical record. And that includes pharmacy and medications through Omnicell. So it was recognized that there's an opportunity for us to do that in these 4 sites. And so once we're launched up and running smoothly, that will follow in order to really make this project sustainable.
Thank you. And Director R. Smith to close.
Thank you, Chair. Thank you very much for your presentation today. That sounds like a very interesting program, and I'll definitely be sort of watching to see how that rolls out over time. I think this is for Logan Lake about the 5th time that we've been involved in recruiting a PRA. In our case, it's, I believe, an IMG. So we have been down this road, obviously, a number of times with no super awesome success in keeping any of them for any great length of time, which then also erodes other services within your health center. And it's really, really hard to show Interior Health that the need is there when the erosion has been there for such a long time. So I'm really looking forward to watching how this does roll out. I'm encouraged. I think that it sounds like a creative potential solution for many of us. And I think that considering the amount of industrial work that's going to be happening in our area, specifically over the next probably 10 years, we'd love to see how things could look to potentially do the same thing for Logan Lake. The other thing I want to mention, if we're talking about what concerns we might have with a program like this rolling out, I think my biggest one would be communications, because I find that that's one of our biggest struggles most of the time. So thank you.
Thank you.
Thank you. And Director Demare, sorry, I do see your hand up online.
Yes, thank you. I guess the question was asked was on the communications piece on the soft launch. What form is it going to take? And similar to my ask on the last presentation, it would be good if it was done in a video form where you're actually talking to a presentation, so that we can share that with the public and on your social media sites and so on and so forth. So, because it's very important. Where I am is SLRD Area A, which is 110 kilometers west of Lillooet. Thank you.
Thank you, Director Demare. We need to put you on our communications team, I think, Susan. I was texted just prior to coming up and presenting that the video that will support our public engagement, that actually just wrapped up this morning. So we'll take your good idea and bring that forward.
Excellent. Thank you. Thank you very much for the presentation and sharing what you have in plan for our rural communities.
Thank you.
Thank you. All right. Oh, sorry. Let the record indicate there was clapping for the interior health presentation. Thank you. Next, we have 7.1 and 7.2. There is no action required for either. They are letters that were written to ministers to advise us what's been going on through Chamber of Commerce and through another HD. So that is there for you to be able to view. We will go into new business, and we have Director Thorpe.
Oops. Thank you, Chair. So everybody would have gotten this in your folders. I'd like to provide, first of all, there is a typo there. So under background, second paragraph, it should say from, not for. We caught it. Thank you. Anyway, the update I'd like to provide is that Interior Health met with me on late Tuesday afternoon. So I'm very appreciative to Diane and Karen and their team for meeting with me and talking about some of the things that are moving forward with the Lytton Community Health Care. For the first time in a very long time, I'm cautiously optimistic that something is actually going to happen. So thank you very much for that. I greatly appreciate it, because it has been an extreme level of frustration in my community. My understanding is that Karen has now reached out to Mayor O'Connor and brought her up to date on this as well. So hopefully we're all on the same page. So the update is, I want to ensure that this momentum doesn't stop. It appears that we're getting somewhere. And so I'd like to look for support and commitment from the province. And so therefore, on your second page, you will see that I am requesting that the board direct staff to send a letter to the Minister of Health and the Minister of Infrastructure requesting a clear timeline for the reconstruction of the Lytton Health Care Center, including details on how the rebuild will be funded, and that the local First Nations be copied on this correspondence. Because as I've mentioned before, I think the more of us that are involved and on the same page on this, the more chance of success we have. So that is my request. So I would like to make that motion, please.
We have a motion on the floor. Do we have a seconder? Second by Director Grenier. Discussion. I'll start. I think the motion is good. The only thing that I would like to amend to add on there is to include the Minister of Finance. As we've gone through many different things, the Minister of Health, it always goes, well, we got to talk to Minister of Finance, and then they kick it back. So I think, as you said, the wider net.
An interesting thing about that is when I had a resident mention something about Treasury, having to go to Treasury. And as all of us know, something goes to Treasury, it takes like 5 years if we see it. Interior Health has assured me, because most of this is insurance, that it will be fast tracked. But I absolutely agree. Let's add Minister of Finance on this.
So would you like to second the motion?
I will.
Perfect. We have an amendment on the motion and discussion on the amendment to include the Minister of Finance. Seeing none, all in favor? Contrary minded, that's passed. Back to the motion as amended. Discussion, sorry. Director O'Connor.
There we go. Thank you. I'm a bit concerned that First Nations are being copied on this, that this is coming from TNRD or the hospital district board and not from the community. One of the local chiefs has been in the process talking to Ministry of Health, talking to IHA, and kind of gathered leaders together in our community to help getting this move forward. So I'm a little bit concerned about them being copied on it. And I'm also concerned why the Village of Lytton isn't copied on this. There's no indication there. So those are two of my concerns with it. I absolutely, 4 years has been too long, and absolutely we need to get moving on this, but I would like to see the
Okay.
Village of Lytton added on as well.
Okay, so that would be an amendment, but Director Thorpe wants to comment back. And
Respectfully, because you are part of this board, I would assume that you would carry this back to the Village of Lytton. With respect to the 6 First Nations being copied on it, as you know, Chief Jordan Spinks has been instrumental in trying to get something moving with this. He did bring the First Nations leaders, myself and Mayor O'Connor into a conversation back in June. So out of respect for the First Nations and to make sure that we are all on the same page, I've asked that they be copied on this so that they're aware of what is happening from the TNRD board, or TNRD, apologies, everybody out there, what is happening on the hospital board level as well.
Director O'Connor.
Yes, so, you know, as a mayor, if I understand this correctly, as a mayor, I wear 2 hats. Of course, I wear the hat of mayor in my village and I sit on this board. And so those are 2 separate things. Yes, I would take the information back, but I also think it's prudent that the village be copied on this.
Is that an amendment you would like to make?
Yes.
Okay, we have a motion by Director O'Connor to include the Lytton Village to be included, second by, Director Grenier. I've got a whole bunch of hands going up here. Discussion on the amendment to include the Village of Lytton. Seeing nothing further, all in favor? Contrary minded, that's passed. So back to the original motion as amended twice. Discussion. Seeing nothing further on that. Director Blackwell, was there anything you wanted to talk about?
Nope, I was just.
Thank you. So we will call the vote on this, please. All in favor? Contrary minded? Seeing none, that's passed unanimously. Online, everyone's hands was up, and Corporate Officer Jeremiah's not getting too mad with me to not get vocal, so that's okay. But I do think this letter is timely. Director or Vice Chair Blackwell and I will be meeting with Minister of Health and Minister of Infrastructure on the 3rd week of November. And now that this letter will be off, it's timely that they will receive that before we get there, and I'm sure that will come up as a topic of conversation. So thank you. Director Grenier.
Thank you, Chair. In the minutes that we had, there was a letter that was going to be sent out. In the minutes, the number is 7.1, and we have a 7.1 that happens to also be a letter. So I think this is a different letter. Did that letter was going to go to the Ministry of Health and Ministry of Infrastructure regarding the feasibility and cost of an additional floor being added to the Kamloops Cancer Center to include a PET CT scanner? And that was carried at our last meeting. Has that letter gone out?
I will defer to Corporate Officer Jeremiah, but that we will be talking about Cancer Center and PET CT while we're there, but I'm not sure if the letter's been sent off yet or not.
I would be happy to look into this and report back to you with the findings. I believe it's still in progress. Thank you.
Thank you for that. Excellent. All right. Any further new business? No, so I'll make a recommendation that we move into closed under 91N2 and 92B. Second by Director Hall. All in favor? Contrary minded, seeing none, we're moving into closed. We'll be back online in 15 minutes. Thank you.